What is health psychology? Health psychology is a branch of psychology that focuses on the relationship between psychological factors and physical health. It examines how behavior, emotions, and social factors can influence the development, maintenance, and treatment of physical illnesses and diseases. The field of health psychology emerged in the 1970s in response to a growing awareness of the importance of psychological factors in physical health. It draws on theories and concepts from both psychology and medicine to understand the links between psychological and physical health. One of the central assumptions of health psychology is that physical health is not solely determined by biological factors, but also by psychological and social factors. For example, stress can contribute to the development of cardiovascular disease, and social support can help to buffer the negative effects of stress on health. Another key concept in health psychology is the biopsychosocial model of health. This model suggests that health and illness are determined by a complex interaction between biological, psychological, and social factors. It recognizes that physical health cannot be understood solely in terms of biological factors, but must also be understood in terms of the psychological and social factors that influence health. Health psychology also focuses on the prevention and treatment of physical illnesses and diseases. It seeks to understand how behavior and lifestyle factors, such as diet, exercise, and smoking, can contribute to the development of diseases such as cancer, heart disease, and diabetes. Health psychologists also develop interventions aimed at changing behavior and promoting healthy lifestyle choices. Another important aspect of health psychology is the study of patient behavior and experiences within the healthcare system. Health psychologists examine how patients cope with illness and medical treatment, and how they interact with healthcare providers. They also seek to understand how the healthcare system can be improved to better meet the needs of patients. One of the central contributions of health psychology has been in the development of health promotion and disease prevention programs. These programs aim to promote healthy behaviors and lifestyles, and to prevent the development of chronic diseases. They may involve education campaigns, behavioral interventions, and policy changes aimed at improving the health of populations. Health psychology has also contributed to the development of behavioral medicine, which integrates psychological and behavioral interventions into medical treatment. Behavioral medicine recognizes the importance of psychological and social factors in physical health, and seeks to develop interventions that address both biological and psychological factors. In conclusion, health psychology is a branch of psychology that focuses on the relationship between psychological factors and physical health. It recognizes that physical health is determined by a complex interaction between biological, psychological, and social factors. Health psychologists examine how behavior, emotions, and social factors can influence the development, maintenance, and treatment of physical illnesses and diseases. Health psychology has contributed to the development of health promotion and disease prevention programs, and to the integration of psychological and behavioral interventions into medical treatment through behavioral medicine.